We've got what I think is probably the most important session of our meeting, which is on driving a more environmentally conscious future for health and medical research. And it did strike me that we're kind of dealing with an existential issue. Unless we get climate and health right, there won't be much medical research because it is such a threat to the continuation of humans on the planet. And we do know that preventing things is not our strong suite as a human race. We tend to react when we have an emergency, but otherwise we hope things will be all right. We've got 3 fantastic speakers. They're going to come up one by one, and then afterwards we will have a panel discussion when you'll have a chance to ask them lots of questions. So without further ado, I'll move on to our first speaker, who is Professor Tony Capon, who is a man of Nai, Tahu and Pakeha descent, and he's also the world's first professor of planetary health from the Monash Sustainable Development Institute, where he also holds a chair in the Faculty of Medicine, Nursing and Health Sciences at Monash. Tony's done lots of work in putting planetary health on the agenda, particularly looking at urbanisation and sustainable development. He's currently chairing a WHO technical advisory group on climate change for the Western Pacific region, and he co-chairs the Future Health Knowledge Action Network and is also a member of NHMRC Research Committee. So no one better than to give us a broad overview of this topic. Thank you, Tony.
Well, thanks very much for that welcome, Fran, and terrific to be with you all here today. I'd like to also acknowledge the traditional owners here, the Kaurna people, and it's so important that we do this when we're talking about planetary health because of the care for country over millennia here in Australia. So my role, just in the first 12 or 13 minutes, is to set the scene for the session around the idea of planetary health and how we need to change the way we think about human health in not just our research, but in our policies, in our practice of health, and in our education. I wanted to start with some images from the 2019-2020 bushfire season here in Australia. This image is people sheltering on a beach in southern New South Wales, sheltering from the fires. This is Sydney, shrouded in smoke for months that summer. And here, people in Canberra wearing masks to protect themselves from that bushfire smoke before we were regularly wearing masks in the country to protect ourselves from the pandemic virus. And this was the media that summer around the world. Those fires made clear to us all that our climate has changed and it's harming our health and the health of all other living things on Earth. Our ecology colleagues have estimated that more than 3 billion animals died that summer. In February, the rains came and doused the fires, and within days, we were grappling with the global pandemic. So as a country, we really haven't fully processed those fires. More recently, we've been grappling with floods. Images here from Lismore in northern New South Wales. Those fires, floods, and the pandemic are signs that the way we live is out of balance with nature. They're symptoms of what earth scientists now call the Anthropocene epoch. In 2014, Richard Horton, the editor-in-chief of The Lancet, convened a commission on planetary health with funding from the Rockefeller Foundation. The title of the report, Safeguarding Human Health in the Anthropocene, addresses how we need to respond in this context. You can see a list there of the commissioners. I was working for United Nations University, at the time directing the Health Institute. And the other commissioners came from different disciplines: environmental science, political science, economics, and from various regions of the world. On that slide, on the bottom of the slide, you'll see that the work we did built on other work, the One Health approach in infectious diseases, and importantly, the Brundtland Commission. You may recall this report, Our Common Future, in 1987, the report of the World Commission on Environment and Development, a commission chaired by Dr. Gro Brundtland, a medical doctor from Norway, who went on to be Prime Minister of that country and later to chair this commission and then to lead the World Health Organization in Geneva. So the whole idea of sustainable development is founded in concern for the well-being of people now and future generations. I can't come to Adelaide without putting this fellow up on the screen as well, Tony McMichael, who is an Adelaide medical graduate and wrote this book 30 years ago, Planetary Overload: Global Environmental Change and the Health of the Human Species. He was way ahead of his time, and in this country and around the world, we're yet to catch up with that thinking. But of course, it goes much further back to the Kaurna people and all Indigenous people around the world. As Fran said, my family is Ngāi Tahu from the south of New Zealand, and Waiora is a Maori word for well-being and healthy waters, and it was the theme for the conference of the International Union of Health Promotion and Education back in 2019 in Rotorua. We actually know quite a lot already about links between environmental change and health. And you can see in this slide, it'd be hard to read, I'm sure, but on the left there, escalating human pressures on the global environment. In the middle, a list of the environmental changes we're seeing. Climate change at the top, but you can go down through the list. Biodiversity loss, for example. And then on the right, 3 broad categories of health challenges. Direct ones, like we saw in those slides at the beginning of the talk, but importantly, a second category of indirect ones. And this is where spillover of novel pathogens from wild animals, perhaps through domesticated animals, to people, comes into play. And then at the bottom there on the right, a third category of flow-on impacts. And this is where these environmental determinants of health intersect with the social determinants of health. We start thinking about mental health consequences of these changes, displacement of people, perhaps from low-lying countries, from low-lying islands in the Torres Strait as well, and the potential for conflict in that context. Importantly, climate change and health is a social justice issue, and I find these scaled maps of the world from Jonathan Patz's group in the United States very useful. The top map here that you can see, a scaled map of the world with who's responsible for the carbon emissions that are already in the system. And you can see that the United States is scaled up, the United Kingdom, Europe, and Japan, countries where there was major industrial revolutions. But who's already being affected? It's people living in South Asia and Sub-Saharan Africa, already dying in the context of these changes. Those least responsible, already the most affected globally, but also here in Australia. Here's a link to that work. There's a 50-page report, but there's also shorter pieces of writing. There's video material and infographics that you may find useful. One thing that was clear through that work is that in health and medical research, we need human ecology as a way of understanding patterns of human health alongside epidemiology in the work we do, in our research, education, policy and practice. And here on this slide, an example from the eminent human ecologist, Stephen Boyden from ANU, one of his books, The Biology of Civilization, and understanding human culture as a force in nature, because the dominant culture is the problem that we face. If we drill down and think about what we do in academic public health work and link that to the way ecologists think, when we think about all human activities, everything that people are doing on Earth every day has got potential for positive or negative impacts on our health. We talk about behavioural risk factors in public health research. We examine the social determinants of health. But there's a new pathway that we focus less attention on, and that's the environmental impacts of development, of those activities, which is affecting the health of the planet, and as we've been exploring, has implications for our health. A new term, ecological determinants of health. You may not have heard of this. It's from our Canadian colleagues. And in the final slide in the sequence, the arrow's going in the opposite direction, reminding us that there's feedback in the system and that there's potential unintended consequences from the interventions we make. So, as I said, from Stephen Boyden's work, just to illustrate, in the work I do, which is focused on the future of cities and what that means for our health and well-being here in Australia and around the world, we're looking at the way urban policy, planning, design, development and management shapes what we do as people and thereby shapes our health and the health of natural systems. So to draw things to a close, and as I'm ready for my next speaker, what should we do in health systems? Three main categories of things to do. We need to prepare for those health impacts from climate change and other environmental changes. We need to take a population health approach and advocate for transitions to sustainable ways of living that are also good for health. We talk about co-benefits for health from transitions to sustainable cities, for example. People walking and cycling, less air pollution in cities. But importantly, we also need to get our own house in order. We need to urgently transition to sustainable healthcare. And during the pandemic, we published this work with colleagues at the University of Sydney, the first global assessment of the environmental footprint of healthcare. And we looked at carbon emissions, but we also looked at particulate emissions, other environmental consequences of healthcare. And what we found was that globally, health systems account for 4.4% of all greenhouse gas emissions, 2.8% of all particulate matter, 3.4% of nitrogen oxides, and 3.6% of all sulfur dioxide. As we care for health, we're harming health. They're all environmental consequences of healthcare. And this slide, just something you might want to follow up, new work supported by the Wellcome Trust on reducing the environmental footprint of health research. We have a responsibility in relation to the research we do as well. So my final slide is three main points. First, we need an eco-social approach in the work we do. We need to recognise these ecological, economic and social determinants of health. We need systems thinking, acknowledging the interdependence of all species, including those we cannot see. Because to be here and healthy, we need trillions of microorganisms on our mucosa to be here and well. So we've got to balance our focus on pathogens with our focus on fostering the good guys. And the third point, a summative point, we need to bring a planetary consciousness to our health research, education, policy and practice. And I think Michelle's point earlier today, let's not forget the carbon consequences of the digital transition in health. It's an example of planetary consciousness in the work we do. Thank you very much.